Good day, ladies and gents. We shall be talking about primary prevention of cardiovascular disease to kick off this AKT revision series. Let's talk about some definitions first of all. What is primary prevention? This is prevention of a disease ever happening by reducing risk factors. Now, cardiovascular disease is three things. It's your brain, cerebrovascular disease, it's your heart, coronary heart disease, and it's your legs, peripheral vascular disease. Now, risk factors can be modifiable and non-modifiable. Modifiable are things you have that you can change by changing the things you do. Things you have like high blood pressure, high lipids, and obesity can be changed by changing the things you do like smoking, physical inactivity, unhealthy diet, and too much alcohol. Now, non-modifiable risk factors are things you can't really change. Family history of cardiovascular disease, ethnicity, male gender, increasing age, and socioeconomic deprivation. However, that last one, start a side hustle, you might be able to change it. Moving on to the healthy individual, this is where we all want to be. We want to have no sugar, no spice, and nothing nice. So sugar and salt, normal glucose metabolism, and blood pressure less than 140/90. Spice of life, non-smoker, less than 14 units of alcohol per week. And everything nice and fatty. So healthy diet, normal BMI, total cholesterol less than 5, physically active. I've added avoidance of stress at the end because I don't completely agree with that being very healthy. Moving on to risk assessments. The NHS Health Check is something we offer every 5 years to people aged 40 to 74 years. Now, we use online QRisk3 calculators to assess the 10-year risk of them getting cardiovascular disease, and this is given as a percentage. Now, we do not use this in people with established cardiovascular disease for obvious reasons. We don't use it if they've already got high risk of developing CVD, and we don't use it if they are over 85 years of age. In all of these people are already high risk. Now, we also consider doing bloods for HbA1c and using these if there is a high risk of diabetes or chronic kidney disease. Now, what happens if the QRisk score is less than 10%? You offer them lifestyle advice for the big three: smoking, raised blood pressure, and raised lipids. Why are they called the big three? Because sorting these out is going to lead to the greatest decrease in your QRisk score. You offer them lifestyle advice, and you reassess in 5 years. Now, if the QRisk score is over 10%, you do lifestyle modification, but that alone might not be appropriate. So you offer statins if they're under 85, or if they have CKD, or if they have type 1 diabetes plus one of these risk factors listed, or if they have type 2 diabetes or hypercholesterolemia.